take mine over there.
Yes, sir.
Hello, good afternoon, everyone. I'm Steve Francis, Special Agent in charge for ICE Homeland Security Investigations for Michigan and Ohio. Thank you all for being here today to learn about ICE's increased efforts to combat the opioid crisis here in Ohio. I'd like to begin by welcoming our distinguished guests who will make a few brief remarks. First, I'd like to thank ICE Director Mr. Tom Homan for recognizing the critical need for additional resources in the state of Ohio and making this a priority for our agency. I'd like to also welcome Senator Robert Portman, the Ohio Attorney General Mike DeWine, the Montgomery County Deputy Sheriff Robert Streck, the United States Attorney for the Southern District of Ohio, Benjamin Glassman, and the United States Attorney for the Northern District of Ohio, Justin Herdmen. Now I'd like to turn it over to Director Homan for a few remarks. Thank you.
Good afternoon. Thank you, Zach Francis. Today's going to be a little different day. I'm not going to be talking about immigration. I'm going to be talking about an equally important subject, the opioid epidemic, especially here in Ohio. Together, our partners in state and local law enforcement and with the support of the U.S. Department of Justice, ICE is committed to helping the opioid crisis in America. Our workforce is dedicated to identifying, targeting, and dismantling the transnational criminal organizations that are flooding our communities with this dangerous drug. These drugs are taking an unprecedented toll on our country, and the challenge of reversing it must be met head-on. According to the Ohio Department of Public Health, the number of unintentional drug-related overdoses in the state quadrupled from 2011 to 2016. In 2016 alone, there were more than 4,000 opioid overdose deaths in this state. Way too many. In response to the increasingly deadly opioid epidemic, last fall, President Trump signed an order declaring the opioid crisis a national public health emergency. In response to President Trump's declaration, ICE Homeland Security Investigations, we refer to them as HSI, a division under ICE, has leveraged its expertise in law enforcement partnerships, both domestically and foreign, to combat this epidemic by tracing overdose deaths in the United States and also the foreign sources supply overseas. Over the last year in Ohio, HSI tripled its focus on drug trafficking. We have tripled our focus here in Ohio. We have doubled our resources here. And I made a commitment to Zach Francis today, whatever he needs, he will get. We are announcing today that we are significantly increasing the number of special agents in this state assigned to work these complex cases by added offices in Dayton and Toledo. We are committed to working closely with every stakeholder engaged in our joint efforts against this deadly scourge. HSI employs a global strategy that starts beyond our borders in an effort to prevent dangerous drugs and those engaged in trafficking these dangerous drugs from ever reaching our borders. We want to play the away game and stop the drugs before they reach our borders. Furthermore, HSI special agents and investigators deploy cutting-edge technology to investigate and enforce ICE's authorities in the cyber realm, where transnational criminal organizations are operating more and more frequently. We are leveraging relationships throughout the financial industry to cut their source of funding. We are using innovative techniques to limit their access to virtual currency. Today, we're wrapping up a week of darknet and virtual currencies training for more than 300 law enforcement personnel here in Ohio. We also conducted the same training for officers in Michigan. Provided at no cost by experts from HSI Cyber Crime Center and Illicit Financial Proceeds Crimes Unit, as well as investigators from HSI Detroit. This training featured an emphasis on illicit payment networks and financial transactions associated with fentanyl smuggling and distribution. Since the President's order in October 2017, HSI has delivered this training to approximately 800 investigators throughout the country, and we're going to train another 1,500 before the year end. With local offices in Cleveland, Cincinnati, and Columbus, HSI is committed to ending this deadly crisis and arresting those responsible for the flow of this highly addictive and lethal substance in our communities. Fentanyl, which the CDC estimates to be far deadlier than morphine and heroin, is coming into the country at an alarming rate. For example, in FY15, HSI special agents encountered fentanyl just 8 times in FY15 and seized a little more than 68 pounds. If you fast forward for 2 years, in FY17, we had 410 encounters and seized over 2,400 pounds. That's equivalent to more than 219 million doses of this dangerous drug. In addition to the ongoing investigations initiated by our local HSI offices throughout the state of Ohio, HSI's 58 Border Enforcement Security Task Forces, we call them BEST units, are the agency's primary platform to respond to this crisis. We have embedded numerous BESTs at international and regional mail facilities as well as express consignment facilities. These units specifically target opioid shipments on a daily basis. Our goal is to connect these shipments to distribution cells across the United States and ultimately the sources of the supply. We will continue our partnerships with federal, state, and local law enforcement agencies on strategies to combat this epidemic and prevent more tragic overdose deaths. So let me stop reading and just speak for a second. I met with law enforcement officers today, and I gave my commitment to them. I gave my commitment to the state of Ohio. ICE is coming with everything we got. The officers here on the ground know if they need money, they need resources, they need equipment, they got it. We're going to stand shoulder to shoulder with our law enforcement partners. This is ground zero, and ICE is 100% committed to ending this plague in Ohio. This is ground zero. Let me say it again. This is going to be a model for what we do in the rest of the country. I'm committed to this. Our president's committed to this, and we will not fail. As far as our local law enforcement partners, you all have to hear me say we got their 6. When it comes to this, we got their 6, we got their 9, we got their 12, we got your 3. We're here to stay until we beat this thing. For those out there who want to traffic in this substance, we're going to find you, we're going to prosecute you, and we're going to put as many of you in prison as we can. With that, I want to introduce a great friend to law enforcement, someone equally dedicated to this crisis and fighting this crisis, Senator Rob Portman.
Director Homan, thank you very much. That was a significant statement we just heard. I want to thank Director Homan for his personal commitment to this and what he's already done for Ohio. We've had a chance to visit in Washington, D.C., and I've seen his passion. He's a tough guy, and he's serious. And he cares about what's going on here on the ground in the Miami Valley and throughout our state. He's already shown that he has a commitment to Ohio by increasing the resources for ICE here in the state, by training the 300 local law enforcement officers over the past couple of days here, particularly in what's going on the internet and cryptocurrency, trying to stop some of this flow. And it sounds like, from what you just heard, this commitment is going to continue and deepen. And we are very eager to be part of a template for the rest of the country. Why? Because we know we have the right people here on the ground to help you. We have the right people here who have learned how to deal with this issue best we can because we've been overwhelmed. I remember coming to Dayton, Ohio about 2 years ago to talk about the heroin crisis, and I was told by our law enforcement task force here that, Rob, it's now fentanyl. Fentanyl is literally pushing heroin out. And that was one of the first cities in Ohio to raise the flag on fentanyl. Now it's by far our biggest problem in Ohio. Last year, 58% of the people who died of overdoses in Ohio died from synthetic opioids, fentanyl and carfentanil. So it's the new scourge. And by the way, if we don't get the fentanyl under control, we won't be able to solve this problem. But if we just focus on fentanyl, something else will pop up. So it needs to be a broader effort, not just focused on one drug or another. I believe, as many of you know, in a all-of-the-above approach. So for years, I've been involved on the prevention education side. I see Rick Beal here. He was on our coalition back in Cincinnati that we started 23 years ago. I've also been involved very much on the treatment and recovery side of things because we have over 200,000 addicts here in the state of Ohio. We need to do a much better job of getting them back into the mainstream, back with their families, back to work. The number one cause of crime here in Montgomery County is this opioid crisis. We need to deal with that issue through not just the prevention education, but taking those who are currently addicted and getting them into successful treatment and recovery. But I also believe that we need to do much more in terms of the supply side. If you don't solve it on the demand side, you're not going to solve it at all, in my view, because as long as there's that strong demand, it'll continue to come. But there's nothing inconsistent with being for stronger law enforcement and focusing on the supply side and focusing on the demand side. They go hand in hand. And we just heard this morning some of the success stories that have happened in terms of dealing with the traffickers, resulting in fewer overdoses and deaths. I told some of you earlier today, Dayton, Ohio is doing some really interesting things. Fingers crossed, and we can't make too much of short-term results, but it looks like in the last couple months we have fewer overdose deaths in Dayton, Ohio than we had last year. How about that? That's a start. Sadly, in other communities in Ohio, it's just the opposite. We see the number of deaths increasing, not decreasing. And it's not just about deaths. That's sort of the tip of the iceberg, as tragic as it is. It's about all the individuals who may not overdose and die, but continue to be addicted, continue to be broken up from their families, continue to be causing crime, continue to be out of work, continue to be not able to achieve their own God-given purpose in life. And they may never overdose and die. So that's not the only measurement we ought to use. But it's still a sickness and a scourge here in our state. So we are really interested and even excited about working with you, Director Homan. I want to thank others who are here today who have been very, very helpful, because we have a great group. It's a combined group. First of all, Attorney General Mike DeWine. Mike DeWine has been making this a focus of his work as Attorney General, not just for the past couple years, but ever since his election. And even before that, he was involved in this issue on the prevention side, education side, treatment and recovery side. So we thank you. We also want to thank Special Agent Francis, who's with us here today. He came into Ohio with me several months ago, maybe a year ago now, to help us all the way from Michigan to deal with this issue of fentanyl coming through the mail. And as some of you know, we just spent the last year in a deep investigation into this issue. We issued a report that's very comprehensive of what's happening around the country. We actually used one of the HSI detailees in our office to be able to get to the bottom of what was going on. And he was able to go online and find many websites. We focused on 5 of them that were happy to provide fentanyl online. They told us 3 things when they tried to sell us fentanyl. One was use the U.S. Postal Service. Don't use a private carrier. Why? Because the Postal Service doesn't require advanced data that allows you to know some information at least about the package, where it's from, where it's going, what's in it. That's required, as you know, under federal law. After 9/11, we required it of the private carriers. We said to the post office, you ought to study it and do it too, but we'll give you some time to get there. That was 15 and a half years ago. They should be there, because these traffickers, I will tell you, they guarantee delivery through the Postal Service. That's what they'll tell you, but not through a private carrier. Second, they said, we want you to use cryptocurrency. So for those who think that Bitcoin's not part of this and other cryptocurrencies, it's very much part of it. Now, we were not in a situation where we were able to do that, so we used more traditional currency, but still they sold it to us. And third, they said, how would you like a discount, a volume discount? The next week, how about this deal? How about that deal? I mean, they are marketers. And it's a deadly, deadly marketing technique, but it's very effective. We were able to trace the individuals who had received some of these packages of fentanyl through these 5 sources alone. And of the 200 people we were able to trace through some help from HSI, we appreciate your help, we found that 7 of them had actually died from overdoses within days of receiving their shipment. So we know what's happening. We know how it's happening. We know that there's a choke point here, which is, as I think Director Homan said very well, away from the border, back from the border. We also know that, again, if we solve this problem, it may well crop up somewhere else. There's evidence now out there publicly, so this is not classified information, but there's now evidence that fentanyl is moving, not just from China, where it is primarily coming from now, but also to other countries, including Mexico, for production. And so, you know, China is the biggest problem. The mail is our issue. We've got to tighten it up. We have the STOP Act that we're trying to get through the Congress to be able to do that. HSI and ICE have been very supportive of that. Homeland Security has been very helpful. The new Secretary has been very helpful. And again, I think that this is a combination. It's a combination of supply side, cutting off that supply, at a minimum raising the price on the street, because obviously one of the reasons fentanyl has come into our state in such a big way is its expense. 50 times more powerful on average than heroin, its power, And then finally, its availability, that you can just get it through the mail. We can't let this continue to happen. But at the same time, we also have to focus better on the prevention side, the education side, the treatment side, and the recovery side if we're ultimately going to win this. And I believe we can win it. I believe the optimism you heard this morning is warranted, but only if we figure out a way to continue to work together. And again, I want to thank Mike DeWine for his leadership on this, and please welcome Attorney General Mike DeWine.
Rob, thank you very much for all that you have done. You've been the real leader in the Congress in regard to this problem. What you have done has really made a significant difference. Mr. Director, thank you for being here. We appreciate it. Thank you for what you just announced. Thank you for what you told us in private before we came in. And we thank you and we thank the President. We thank President Trump for his focus on this issue. He truly understands the gravity of this. The situation in Ohio is, as we discussed, grave. There is good news and bad news. First, the good news. The good news is that we have people in every community in this state who are fighting back. Many times it's led by a mother or father who's lost a loved one, lost a child. We have citizens groups that are working on prevention, education, working on treatment. We have law enforcement agencies in Ohio who are doing something that 10 years ago I don't think any of us would have ever thought law enforcement would have done, and that is work on getting people into treatment. We've got some very, very innovative programs that are going on in Ohio. And it does take this holistic approach of treatment, making sure people get in treatment, stay in treatment, then what happens when they get out. The education side, we're doing more. I would like to see us do even more in Ohio. As far as I'm concerned, we should start in kindergarten and go K through 12, do something every single year that's age appropriate, every single year something that's already been proven to actually work. And I think that certainly is my goal. But that's the good news, that a lot of good things are going on. But as Rob Portman said so well, fentanyl has been the big game changer. With its high potency, with the fact that it's being mixed into other drugs, the user frankly has no clue what they're taking. They're chasing a high, but they don't know the content exactly. And that's why I think we see the death numbers remain so very, very high in the state. It is having consequence not just with the 15 or so people every single day who die, but if this was a typical day, 15 Ohioans will die. More children will be born, more babies will be born addicted to drugs in Ohio. More kids will go into foster care. Our foster care system with our 88 counties, all 88 counties is bursting at the seams with kids. We are now finding, Mr. Director, that what these children's services are having to do in some counties is to send kids outside the county. And in other counties, they're sending them 100 miles, 200 miles, 300 miles away because they can't find any homes. The other point that I think that sometimes is missed, because it's very hard to calibrate or calculate, but as I go into businesses around the state and I ask them the number one concern they have, used to be taxes, used to be regulations, now it's I can't find people to work. And I can't find people to pass a drug test. Mr. Director, we have a huge number of Ohioans who are not living up to their God-given potential because they can't pass a drug test. They're either underemployed or unemployed. When I go in and talk to businesses, I ask them what if they drug test. If they say yes, I say what percentage of people come in here either won't take the test or fail the test. Put those two numbers together, and the answer comes back 40% almost every single time. So it's a huge, huge group of people who are out there. We do need your help. We thank you for what you've already done. We thank you for what your commitment today. Our office, BCI, Attorney General's office, works very, very closely with local law enforcement. We work with your folks on the bulk cash task forces. These have been extremely successful here in Dayton, Ohio. It's worked very, very well. We also have these task forces in Columbus, Toledo, Cleveland, and the Mahoning Valley. And we hope to continue to put more resources in those, and we again appreciate your commitment to that as well. Let me introduce a person who we work with very, very closely in the Attorney General's office, and that is Rob Streck, Chief Deputy, Montgomery County Sheriff's Office. We work with Sheriff Plummer, we work with Sheriff's Office, and they, as Rob said, Dayton, Ohio has really been at the forefront. Montgomery County has been at the forefront. That's the bad news. The good news is we're fighting back, and we've been fighting back for some time. So, Chief, thank you very much for coming. Turn it over to you.
Hello. I want to thank Director Homan for having us here and to speak at this event. The Range Task Force and the Miami Valley Bulk Smuggling Task Force have been hugely successful in Montgomery County. A large part of that success is the collaboration between local and federal law enforcement. Over the past several years, Sheriff Plummer and several of the chiefs who are part of those task forces sitting in here today have been pleading with other agencies to give manpower to help out on these task forces. Unfortunately, mainly due to lack of resources, not many people have been able to give those resources. Where we did get a great response was from Homeland Security. Homeland Security and Director Homan stepped in and provided additional agents for each task force. They provided necessary equipment for us, and most importantly, they provided overtime to help with these investigations. Organized crime task forces rarely know when something is going to jump off. When something does go and there's something's moving, we have to be ready to respond to that. So a warrant that is served in Montgomery County can very likely lead to warrants in multiple other counties and sometimes even other states. These task force officers that are working, they come to work one day and they literally may not go home for 3 days because they're constantly out. The ability to fund these operations and these investigations is essential to protect our community, to get the poison off our streets, and to get the bad guys out of our communities and put them in jail. Another advantage of Homeland Security is cross-coordinated investigations. As I mentioned, and it happens more often than not nowadays, I will get a call from our task force commander, and he'll say, hey, we just hit this house. We've got this, this, and this, but it's led here. So more often than not, even though we hit a warrant and it may end that investigation locally, it may be only the beginning. And having these relationships with HSI and others allows the investigation to continue to other states, hundreds, maybe even thousands of miles away. And that is a huge advantage in fighting the war on drugs. In 2017, Montgomery County Public Safety responded to approximately 3,537 overdose calls. Out of those overdose calls, we lost 562 of our loved ones. Those numbers are not complete yet. We are still waiting on numbers from November and December. It could rise, it could go lower. We don't know at this point, but we do know we lost too many of our loved ones and our community members. These calls for service took a huge toll on our dispatch centers, on our first responders, and our communities. People who think that this epidemic hasn't affected them, they need to think again. Law enforcement, fire, EMS live off of something called mutual aid. Mutual aid exists between cities, townships, villages, and it's there so that even if there's a lack of resources, we always have first responders responding to assist the community. So what happens when we add 3,600 calls per year to our community, mutual aid becomes very important. If City A is having an overdose call and their medics are out there and then they receive a call for a heart attack, Township B has to step in and respond into the city. Once that occurs, if something occurs in Township B, then we have to call City C. And it is a snowball effect that has a huge effect on the amount and the quickness in response times and the amount of money and taxpayer money that is eaten with these additional dispatches. Many people want to take the easy way out right now and say that our overdose deaths have decreased, therefore the problem is solved. In Montgomery County, our overdose deaths have decreased. But when you look at the numbers, we're still between 25 to 30 overdose deaths a month. Not quite the victory we want, but they have decreased, so there's a lot of talk about how well we've done. But we can't take thinking that because our community is actually talking about it, the business community is actually talking about the dangers of these drugs as an embarrassment. We have to think of it as a victory for the people, many people in this room who have been out fighting day in and day out to get the message of how dangerous this poison is out there. Obviously, we hope that the numbers continue to go down, and we hope that the numbers and the amount of people who are aware of the dangers continue. Although the overdose deaths have went down, the illegal drugs are still being smuggled into our community. We know that. We know what the task forces are still dealing with. Fentanyl mixtures may have changed to cocaine and methamphetamine mixtures, but it's still out there. That's why it's so important that we continue relationships and collaborations with HSI and anybody else who's willing to help. So I want to thank you for the great work that you've done in this great country of ours, especially the work you've done in Montgomery County. Thank you to our partners who are sitting in this room on these task forces and who have tried and have really made a difference in our county. Thank you.
Good afternoon. My name is Benjamin Glassman. I'm the United States Attorney for the Southern District of Ohio. There is no doubt in my mind, or any of yours, I'm sure, that the opioid crisis that we're facing today is the public health and safety crisis of our lifetimes. And I agree with everybody who has spoken that it's going to take all of us working together to solve this problem. And when I talk about all of us working together from a law enforcement perspective, I mean federal, state, and local law enforcement, as you see reflected here today, even international law enforcement. And then I also mean, generally speaking, not just law enforcement, but the public, teachers, educators, doctors, community members, faith leaders, everyone working together to solve this problem. From a federal law enforcement perspective, I want to echo something that Senator Portman and General DeWine said, that even though we're talking about enforcement principally today, we need prevention, enforcement, and treatment in order to solve this problem. But for right now, I want to talk a little bit about enforcement. From my perspective, we need to do at least 6 things. We need to prosecute the dealers whose drug distribution results in overdoses and deaths. We need to continue to identify and prosecute those doctors and pharmacies who act not as doctors and pharmacies, but as drug dealers. We need to interdict the drugs physically. We need to dismantle cyber channels, as the director was talking about. We need to identify and remove regional distribution networks. And then from my perspective, we need to reach beyond our borders to identify and prosecute foreign cartel leaders that are supplying the drugs, because we need to raise the cost for those cartel leaders of doing this kind of business. HSI has been in the thick of this fight with us. I want to bring attention as one example to the Edwards case that we prosecuted out of our office in Columbus in the last year. Actually, it's awaiting sentencing right now, and that's in the first category of cases, identifying and prosecuting those drug dealers whose distributions result in death or serious bodily injury. That's a case where HSI, through intense, timely investigation and aggressive prosecution from the AUSA in my office, identified and prosecuted a dealer who admitted that the drug distribution that he sent out resulted in the serious bodily injury of one person, and then also admitted and took responsibility that the drug distribution that he distributed to another person, who then distributed it yet again, caused the third person's death. That case is awaiting sentencing and is an example of the excellent work that HSI has been doing with us here in the Southern District of Ohio. In fact, if I could just divert for 1 second, when we're talking about transnational criminal organizations, also under the umbrella of ICE is enforcement and removal operations, and I think that they are also critical to this fight. As just one example, again, locally, the work of the ERO agents as part of our team in our MS-13 prosecution in Central Ohio has been invaluable, because when we're talking about prosecuting people who cross national borders, we're talking about Mexican nationals, Chinese nationals, Canadian nationals, we need that experience and expertise as well. In talking about opioids and HSI and ICE's role in investigating and stopping them, one point I want to make that was just alluded to is that we can't lose sight of other threats. So although the public and medical awareness of the dangers of opioids, pain pills, that's way up, and that's a good thing. And prescriptions for those kinds of drugs are trending down in Ohio and elsewhere. That's not so with stimulants. Prescriptions for stimulants are increasing. Overdose deaths due to methamphetamine, and cocaine are also increasing in Ohio. And so even as we work together on the opioid crisis, we must be careful not to trade one horrible problem for another one. And that's why, from an enforcement perspective, shifting resources is not enough to meet the challenge. We need additional resources, and that's why I'm so grateful for ICE's commitment to bring the additional resources here to Ohio. And I should say, with respect to those stimulants and the street stimulants, HSI has been an incredibly valuable partner for us in the U.S. Attorney's Office on that front, too. Another case that we prosecuted just this past year involved 2 Canadians who were taking 290 pounds of cocaine from the Bahamas to Canada, but HSI managed to interdict them here in the Southern District of Ohio, where we prosecuted them, and they are now both in federal prison. I guess I want to close by saying that it's tough when you deal with these kinds of serious problems day in and day out not to be overwhelmed. But I believe that there is real cause for optimism. As I mentioned, as a lot of the speakers have mentioned, prevention is increasing. Awareness is up. These are good things. Even with simply enforcement, we can make a difference. As one last example, just within the last several months, our office, working together with federal, state, and local law enforcement, took down a regional drug trafficking organization in Middletown that had a connection to the Sinaloa cartel in Mexico. Since that takedown, since those people were taken off the streets in Middletown in December, if you consider the overdose rates for Middletown in January and February, they are trending down. And it is an example that although the numbers for the state are still way more than we can tolerate, we can make a difference. We are making a difference. And working together, we will make a difference. I thank ICE and I thank everybody for their partnership in trying to get this job done. And with that, I want to turn the podium over to my friend and colleague, Justin Herdman, the United States Attorney for the Northern District of Ohio.
Thank you. Thank you to everyone who's here today, and thank you to Director Homan for visiting. Thank you to Senator Portman and General DeWine as well for your presence. I felt it was important for me to come down from Cleveland to join in this announcement, because this really is a partnership across the state. We try very hard to work together every day, and we're doing a great job of it. And I've spent over a decade in law enforcement as a prosecutor, and I've never seen closer coordinated and better coordinated law enforcement efforts amongst federal, state, and locals as I have since becoming the U.S. Attorney in August of last year. So again, I come at this problem like a prosecutor, and I look at it from an enforcement end, but I agree with everything that's been said up here, which is that this is a once-in-a-generation crisis. And to get your way out of a once-in-a-generation crisis, you need everybody on board. Everybody has to be pitching in. It's not just law enforcement. It's also our hospitals, it's our schools, it's our police, it's parents, it's students, treatment providers, political leaders, everyone. And today's announcement goes a long way towards addressing the enforcement end of this problem. The simple fact of the matter is that today's announcement will bolster HSI's efforts to stem the flow of deadly carfentanil, of deadly fentanyl, and other drugs into our state and our neighborhoods. And why is that important? Well, quite simply, heroin doesn't get processed in Huber Heights. Carfentanil doesn't get manufactured in Kettering. It's coming from China and it's coming from Mexico. And that's why the role of HSI is so critical here and why the resources spoken to by Director Homan are absolutely essential. With these additional resources and training, it is going to allow us, all of us, to stem the supply of these drugs while we work to curb the other end of this, the demand side, as Senator Portman referenced. And we know this approach can work, and it can work when we work as a team and when we work in conjunction with HSI. Just this week, our office in the Northern District of Ohio, we filed additional charges against a Chinese drug trafficking organization. They were linked to deaths in the Akron area, overdose deaths in the Akron area, and this is a case where our local police were on the ground working an overdose case. They linked those overdoses through the very hard work of the DEA to a local dealer, and then HSI and DEA were able to work together to take it overseas. And HSI has delivered a tremendous case, prosecuting all the way back to a Chinese dealer. We've worked with them to continue to make undercover buys in this space over the dark web and to identify sources and streams of supply for synthetic opioids. And this case that we indicted this week, it involves Boston, it involves areas outside the United States, but it would not have been possible without HSI. And we're confident that we can continue to bring critical cases like this in a very important space with the additional resources announced by Director Homan. And I'm confident that we will continue to see additional cases restricting the supply as a result of the commitments that he has made here today. So thank you again, Director Homan. Really appreciate you being here. Thank you on behalf of Ohio for being here. Thank you.
Thank you very much to all of our speakers. We'll open it up for questions at this point. Okay. We must have did
I would like to ask just about when you were talking about Senator Portman, just about it coming through the mail, fentanyl, that kind of thing comes through the mail, and I know you have a bill out. So what is Homeland Security, what is ICE doing about fentanyl and that kind of thing coming through the mail?
As I said earlier, and I hope I don't get Director Homan in trouble here, law enforcement at the federal level has been very supportive of our legislation. Why? Because they need this information. And when they have it, they're able to go into a distribution center, such as UPS center I was at in Columbus, Ohio, with you. And they can pull off the distribution system packages that are suspect, and they can check them. But in the U.S. mail system, they've not been able to do that. Now, in the last year, the U.S. Postal Service has responded to our strong cries for them to do something, and they now are testing about 36% of the packages. In other words, I'm sorry, they're requiring advanced electronic data on about 36% of the packages. The problem with that is it leaves about 319 million packages coming to our country every year without that data. Number two is 20% of those packages have not been presented to law enforcement by the Postal Service, but they go into distribution, into circulation, into our communities without having been checked because they just haven't been able to figure out how to put together a system that works. And finally, much of the data that they required of that 36% is not legible. It's not helpful data. So we have to take it to the next level. And I would tell you, Department of Homeland Security, and including the new Secretary and Director Homan, have been very supportive of saying, we need this data. With this data, we can help to stop this stuff. Is it the solution? There's no one solution. But it is very helpful to be able to identify these suspect packages. You got almost 1 million packages coming in every day, so you got to do something. And it's like finding a needle in a haystack if you don't have some data. And so I'd love to hear from Director Homan about it, but we think we can do better. I think the legislation would be a requirement that would be very helpful. Even without the legislation, though, we got to get the Postal Service to coordinate better with the Department of Homeland Security, Customs and Border Protection, who provide this this immediate help and working with HSI to be able to stop this poison from coming into our communities. It's outrageous that we have people dying here in Ohio, and yet there's something that can be done through a federal agency, and we're not doing everything we possibly can.
I'm going to turn it over to Zach Francis. I have not spent one investigative hour in Ohio. The man who is leading the charge for the Department of Homeland Security is standing behind me. So I want Zach Francis to talk about the incredible work HSI is doing here.
Thanks, sir. So thank you. So we have two package interdiction task forces that we're working, one in the Northern District and one in the Southern District, with the United States Customs and Border Protection, Postal Inspection Service, DEA, many of our state and local partners. The initiative started in the Northern District in 2017, and since the inception, we've had over 21 controlled deliveries of fentanyl in that area. So there's a tremendous effort that's focused on interdicting the packages that are coming into the entire state of Ohio. And I look at it really as a model that we're setting there in Ohio for the rest of the country. So the efforts are really strong. There's an excellent collaborative effort with all of our partnership. And I can't recall who said it earlier, but I've been in many offices around the country, and this is probably the most close-knit really state that we've worked closely with DEA, FBI, U.S. Postal Service, all of our state and local partners, and I'm really proud of the work that we're doing here.
Can you talk about the office you guys are saying is going to open up in Dayton? What does that look like? What is that happening?
Sure. So we have just received approval to open up an office in Dayton and also an office in Toledo, Ohio. We're going to co-locate our agents with the DEA and also Montgomery County Sheriff's Office here in Dayton. And we're also going to co-locate our agents with the DEA in Toledo and also the Toledo Police Department there. And we're working with the organized crime, OOCIC. The organized crime oversees the bulk cash initiatives through the state of Ohio. So it's a cooperative effort that is funded by the Attorney General's office. So that's been very successful for us. So the bulk cash task forces is where our HSI priorities are, where we cross-designate our state and local officers to have Homeland Security Investigations Authority. So we're going to partner both with federal and our state and locals as well in those offices.
So you'll be bringing in like new agents here?
Yes.
And then when does that start?
Hopefully this year. We've received the approval. The announcements have gone out, and we have a couple agents already are waiting for funding for Toledo, Ohio. And within, I believe, the next couple of months, we'll have two agents in Dayton, Ohio. So our agents in Cincinnati, we have an office of 15 agents in Cincinnati. They cover the Dayton post of duties and travel back and forth. So it's been, a challenge in a lot of ways. But the Montgomery County Sheriff's Office is a space where we put in one of our agents with there on the task force.
Can any of you guys talk about the training that our local officers got yesterday over the last week?
Sure. So our cyber division from Washington, D.C. has trained over 300 state, local, and federal law enforcement agencies. We started in Michigan, and it's evolved from, we started in Detroit, Michigan, then Cleveland, Columbus, and Cincinnati. And the training they received is on dark web investigations and cryptocurrency. So it's kind of a 10,000-foot approach to the way we do it, across the country, working with our National Targeting Center, or CBP's National Targeting Center in Washington, D.C. And then they provided case examples of investigations that were successfully prosecuted over the dark web.
We have time for more questions. 2 more questions. All right. That'll conclude our press conference. Thank you all for being here.
Thanks. Yeah, it's important. Thank you.
Yeah, we'll see you in D.C.
Love your task force.
Yeah.
Rob.
Good luck on Tuesday.
Appreciate everything. Thank you very much. It's working.
Good to see you again. Nice to see you, sir.
All my research from Michigan, so I we got them. Doubling our indictments prosecution. Nothing very aggressive. Task forces, so it's very exciting. Our EAD came last year, and so